I'd like to mention, if you have any questions, please feel free to share them in the chat. BNIA staff will be answering them as best as they can. If it's something that requires more than a sentence or two of explanation, we'll try to get to some of those questions at the end. I believe we have everyone mic'd, so hopefully everyone can stay mic'd. We don't want to hear anybody using a blender to make up an afternoon smoothie, or anyone that might be listening into their kid's first violin lesson, that sort of thing. So thanks. So today we're going to be talking a little bit about some data work that we've been doing in response to the coronavirus. We've been getting a lot of questions about how the coronavirus and its cases have been impacting Baltimore City, and we've been using a lot of our data and resources to start answering some of these questions. So really briefly, the Baltimore Neighborhood Indicators Alliance, we are an organization that started about 20 years ago. We're based at the University of Baltimore within the Jacob Frantz Institute. We're kind of a one-stop shop for data and information about Baltimore's neighborhoods. We are very comprehensive, and our data is longitudinal. So this means that we look at a lot of data across many topic areas, and our data is for a very long period of time. So for many of our different statistics, you can look at data going back 20 years. We were originally created to be this one-stop shop of data and information through the National Neighborhood Indicators Partnership. This was an initiative that came out of the Urban Institute about 20 years ago around the idea of data democratization. So if data is being created by residents for residents and folks should have access to it. So we've been thinking and doing open data for 20 years, before open data was really even a phrase that people knew about. So in addition to the Baltimore Neighborhood Indicators Alliance, there's about 36 other cities across the country that do very similar work, looking at things like housing, children health, or other topics relating to neighborhoods. You can check them out at neighborhoodindicators.org. So one of our signature projects is the Vital Signs Report. So we've been publishing vital signs for now 18 years. This spring, as I mentioned earlier, we released our 18th edition. So this contains data and indicators through the year 2018. We look at data from approximately 50 different sources every year to compile over 100 community indicators across 8 different topic areas. So we look at some basic census demographics, so who are living in Baltimore's neighborhoods, thinking about things like age, race, ethnicity, some socioeconomic indicators, housing and community development, so thinking about the housing markets in Baltimore, children and family health and well-being, so this would be like some birth statistics, death statistics, child-led, that sort of stuff, crime and safety, pretty self-explanatory, workforce and economic development, so who's working in neighborhoods, what businesses exist, arts and culture, this is kind of a newer set of data. We look at things such as locations of public art installations, library card memberships, education and youth, so different statistics that describe children attending public schools, things such as attendance, enrollment, and also test performance. And then lastly, sustainability, which is kind of a catch-all for things like commuting statistics, things like energy usage, sustainability indicators such as cleanliness of neighborhoods, so looking at 311 customer service requests to CityStat. So all of these data and indicators are available on our website, bniajfi.org/vital_signs. There you can find a ton of information. So if you like to read about data, we've got some data narratives. If you like to look at charts, we've got charts. If you like to visualize things into line graphs, bar graphs, we've also got those on our website. And if you're like me and have an interest in map making and GIS, we also have an open data portal for all of these things. And you can access all of that on our website, bniajfi.org. So getting back to these coronavirus questions that we started getting about a month and a half ago. So people were really interested, and this is generally at a national level, but also locally. We were getting questions like, what sorts of populations, so what people are vulnerable to the coronavirus and its impacts? And also, what are some of the implications of the stay-at-home order that went into effect here in Maryland in March? And then specifically thinking about neighborhoods. So those populations, people that are vulnerable to coronavirus, where are they concentrated in Baltimore? What does that look like at a neighborhood level? And then also thinking about some of those other implications. So where are the concentrations of households in Baltimore that are housing insecure? So where are residents paying a significant portion of their income towards housing costs? Where are the households that are economically insecure? So households in poverty or households with a low median household income. And then also thinking about things like essential workers, who uses public transportation to get to work. That's something that I've received a few questions about, especially given that a lot of folks are relying on public transportation to get to their jobs, to get to healthcare, with the MTA kind of cutting back some of their service. Like, where are those populations existing? And then also, and this one's very important too, where are folks in the city that might be digitally disconnected? So thinking about digital access and digital equity. So who has access to the information on the internet about education or for working from home? And this is not just internet available on a smartphone, but who actually has a computer connected to the internet? So a lot of implications for that. So in order to answer some of these questions, we started putting together a few different visualizations, which I will be highlighting on our coronavirus open data portal. So the first thing that we kind of started looking at was an infographic that we put out in March. So working with other researchers, so some of our friends in San Antonio that are a member of the National Neighborhood Indicators Partnership, we worked with them to obtain a model that's used by epidemiologists to calculate the number of lives that would be saved if people were staying at home rather than traveling, going to the office, going out shopping. And so March 30th, that was the day that that order went into place in Maryland. And so looking at the time, we released this 1 week after that March 30th, looking at the number of people that would be saved from 1 week of staying at home and then cumulatively across time. So looking at something like 60 days at home, that would be approximately a number greater than all the lives that would have been saved from heart disease and stroke deaths in Baltimore, which would be Baltimore's top cause of death. So that was kind of our first kind of dip into the analysis of, you know, what are some of these impacts, and you know, what is some information that we can start communicating to folks through social media and through outlets like this. So from there, we started taking advantage of some of the other things that we have at our disposal. So we use ArcGIS Online to help share out a lot of the data and the resources about our vital signs report. And so we started building some web maps using the ArcGIS Online system. So one of the first things that we did was to see if we could access the Maryland Department of Health's coronavirus cases by zip code. And once we were able to get that, we started visualizing that data and information with some of our vital signs community indicators. So this is something I will show in a moment or two. And then also there were some questions about what are some of these side effects, if you will, of people staying at home. And so there have been a couple Baltimore Sun articles indicating that crime has actually been on a decline since the stay-at-home order went into place. And so we put together a dashboard, again, using ArcGIS Online to kind of visualize that first quarter, so January 1st through March 31st of 2020, compared to that same time period in previous years. And what we're seeing is that violent crime isn't necessarily decreasing, but property crime is as well. So these visualizations are all captured in one place, our coronavirus open data portal. And you can access this from our website. We're going to be sharing it out on social media a lot, especially as we start adding additional pieces to this open data portal. So I am going to switch over to this portal. It's coronavirus-BNIA-JFI.hub.arcgis.com. And again, that's kind of a mouthful. It's a lot to type. We have it linked on our website. So when you come into this portal, the first thing that we have is that coronavirus cases by zip code and our community indicators map. So one cool thing about the data that the Maryland Department of Health is sharing is that their data is constantly being updated. And so every day at 10 a.m., they push out a new data set that has a new count of cases. This is not deaths, just total cumulative cases by zip code. And so when you come to our website, you can see the proportional sized circles relate to the number of cases. And the colors behind that, those are our 55 community statistical areas with our different indicators from vital signs. So this is 2018 data behind it. So the default view is the coronavirus cases by zip code. And these are all things that you can kind of turn on and off on that right-hand layer. And we've got the older adults, so the percentage of the population that is 65 and older in Baltimore. So for all of these different data layers, a darker color, so this darker shade means a higher percentage. And when you click on some of these, if there's that little caret on the right-hand side, you can click on that and it'll drop down the full legend so you can see what some of these numbers look like. So immediately off the bat, you can kind of see the 21215 zip code out in Northwest Baltimore. That has 427 cases just for that zip code. And then if you were to click on some of these community statistical areas, so I clicked on Dorchester, Ashburton, you can see that for 2018, 21.7% of the total population was over the age of 65. So in addition to looking at older adults who are more vulnerable to and have higher mortality rates from coronavirus, we also chose to visualize school-aged children. So these are percentage of the population 15 to 17. These are kids that are not in school, so they're at home. So parents have to either assist with childcare, they have to assist with online learning, and this definitely is kind of a change in pace and something that folks are really having to do a lot of adjustments with. We also visualize race and ethnicity. So we look at the percentage of residents that are Black, African American. We also look at percentage of residents that are white and also percentage of residents that are Hispanic. We also have visualized some of these housing and economic insecurity layers. So you can check these out. So percentage of households paying over 30% of their income on rent, households earning less than $25,000, households with no vehicles available, and then lastly, that piece, digital access, so the percentage of households that do not have internet at home. So this has been a really valuable tool, I think, in bringing together these different sorts of data sets. So the data that BNIA has created for vital signs, so all these community indicators, and this data that is being owned and updated by the Maryland Department of Health. So you can do a couple other things on this map in addition to turn those layers on and off. We have this little details button. So if you click on that, that is up here at kind of the top of the map, you get a little bit of information about why did we choose some of these indicators and a few links to other resources. And you can also do things like share this map, so you can email it to somebody, post it somewhere, and then you can also do a print if you wanted to grab like a PDF of this or if you wanted to send it to your printer. So I'm going to scroll down now, and you can see some of the links to our other visualizations. So the next thing is that infographic, the Saving Lives by Staying at Home. So we, in addition to creating the infographic, put together a blog post with a lot of the information about how these numbers were calculated and what does it mean for residents, as well as some of our credits, our great partner Community Information Now in San Antonio that helped us with this. And we've got the link down here to read that blog post so you can see all that information. And then down at the very bottom is our dashboard where we pulled together the crime data by quarter. So thinking about what's kind of going on in terms of crime and safety. So I'm opening this up. So as I mentioned, this was also created using ArcGIS, the operations dashboard. And so when you come in here, you've got this left-hand slider that tells you a little bit about why looking at crime is important. And we also have some links. So where you can access this data and information. This is just data coming from Open Baltimore, as well as that Baltimore Sun article. So you can close this left-hand drawer. So I'm going to click to close it. And then we'll give this a second to load. So we've got a couple different visualizations in here. So we have a map that highlights the locations of violent and property crimes for January 1st through 2020. On the right-hand side, we have at the top bar charts that compare the year-to-year homicides, robberies, assaults, rapes, and shootings, so violent crime incidents for 2018, 19, and 20. If you hover over each of these bars, you'll see the total number, and then you can click on these different tabs to look at the different types of crime. So again, violent crime is at the top, property crime at the bottom. So again, comparing the first quarter, so January 1st through March 31st for larcenies, burglaries, and auto thefts. So again, as I mentioned, rape is an exception, but for homicides, the number is very similar, so 70 in 2019 versus 69 in 2020. Robberies, again, very similar numbers, assaults, so on and so forth, but these property crimes are coming down. On the bottom of the map, we have a total. So for the first quarter, we had about 2,500 violent crime incidents and just under 5,000 property crime incidents for Baltimore. So this map kind of shows different clusters of crimes, the violent crimes and the property crimes. And as you zoom the map in, you get more information. At the zoomed out view, you can click on the map and see things like in this particular part of the city, there were 554 larceny incidents. But again, that's such a high number and it covers such a large area that it makes sense to zoom in to see the actual points. So in the bottom right-hand corner of that map, you can click that little plus button and it will start zooming you in. So we have different icons for different types of crimes. So I'm going to click on this little button in the upper right-hand corner, and that will open up so you can see the different icons for shootings, homicides, all of the violent crimes, and also these symbols, so indicating the number in a particular cluster. And these clusters will get smaller and smaller as you zoom into the map, and then the property crimes. So again, you can see some of this variation. So down here, you've got a little bit of some robbery cases over Harbor East robberies, but zoom in and you can start to see some distinguishing things. So I'm going to click on this area right here, 24 incidents of larceny from auto, meaning something was stolen, unattended property was taken from a vehicle. And then some of these others you can click on. There's no predominant crime type, so it'll just say the cluster is none. But we do have these little options and these pop-ups to click through and see. Whoops, in that case, it didn't bring it up. Oh, sorry. I created this and I already forgot how to use it. So we've got this little option right down here to click Browse Features. So you can see these individual incidents and all the details, the date, the time, the location, if it was inside or outside. And again, all this information is being pulled from Open Baltimore, data being published by the Baltimore Police Department. So we're currently in Q2 for the year, and so our plan is to continue updating this and pulling this information from Open Baltimore so that you can then compare, well, how is Q2 of 2020 doing to the previous years? So that is about it in terms of the visualizations that we've created so far. So I would say if you have an idea, if there's something kind of cool that you would like to see, if you're already familiar with some of our vital signs indicators, if there's an indicator that you might like to see added to that map, something that we might not have thought about, you can always drop us a line, make a suggestion, and we'll see if that's something that we can just slide on into that map. So I'd like to kind of end it there, and actually, since we have a minute or two, just show very, very quickly. So in this case, in that upper right-hand corner, we have, it's called a little hamburger, so the little 3 lines. That's just going to take us back to the BNIA homepage. So we're putting together a blog to share out this information about this portal, but you can access it from our webpage if you just go to Open Data Portal. This is from our home. And here's where you can access all of the data sets that we've been publishing. So here we go, the Exploring the Impacts of COVID-19 on Baltimore's Communities. And shout out, this is also where you can get the vital signs data. So all those 2018 statistics that I was mentioning.